Hello, my name is Emily Dogren, and today I will be doing a speech on fetal alcohol syndrome, which is also known as FAS. Beer, wine, and vodka. According to Phelps and Grabowski, fetal alcohol syndrome is estimated to occur in 1.9 per 1,000 births worldwide. Today I'm going to inform you about fetal alcohol syndrome, also known as FAS. Mainly, I'm going to explain what fetal alcohol syndrome is, how it is caused, and the characteristics of children born with FAS. First, I will begin by explaining what fetal alcohol syndrome is. FAS is a pattern of irregularities, including mental retardation and minor physical abnormalities, often found in the children born to alcoholic mothers. FASD is fetal alcohol spectrum disorder. They call it this because it is rated on a spectrum of effects. In order to diagnose FASD, doctors look at the maternal history of alcohol exposure to the fetus. The problems caused by FAS continue into the child's school years into adulthood. The amount the mother consumes contributes to the severity of the disorder. Surprisingly, binge drinking has a greater effect on the fetus rather than consuming the same amount of alcohol over a long period of time. This is because of the higher concentration of the alcohol in the blood, which means there is a higher concentration of alcohol that is open to the fetus. The way that FAS is caused is because when a mother drinks, the alcohol is passed through the placenta, which then goes to the baby. The fetus relies on the placenta to clear alcohol levels from the blood, and when binge drinking occurs, the placenta cannot clear it before getting to the child. When a significant amount of alcohol affects the neurotransmitter production, cell development, cell migration, and brain growth throughout growth, the central nervous system can be changed. Some characteristics of FAS are the same from childhood to adulthood, and some are different. There are many characteristics of child born with fetal alcohol syndrome. Some infants that are born with FAS are drastically smaller. They have height and weight deficiencies as well as head size. The most noticeable qualities of an infant with FAS are small head circumference and the characteristics of facial features of the eyes, nose, and mouth. Defects affecting the infant's nervous system are a weak sucking reaction, poor feeding, disturbed sleeping, irritability, and spasms in which the head and heels are bent backwards and the head and body is bowed forward. The effects of FAS are more obvious in preschool children. The physical appearance for preschool children continues to be a smaller head circumference and a lower height and weight. Hearing and vision problems can also occur due to FAS. Language delays are often seen in the preschool years. They also show characteristics of being distractible, impulsive, inattentive, uncooperative, poorly organized, and little persistence toward a task completion. After the child hits puberty, the facial deformations are not as prominent. Because of the effects of alcohol during pregnancy, FASD has now become more prominent than a lot of major disabilities. Most children with FAS have the same characteristics and impairments. Children with FAS can get accommodations and modifications they need in a school setting. Every year that FAS is not prevented, at least 7,000 more babies are born and will grow up disabled. To go over some of the facts of fetal alcohol syndrome, it is more prominent than a lot of major disabilities. The language delays are often seen in preschoolers. It occurs in 1.9 per 1,000 births worldwide. Binge drinking is worse than having a drink every day. There is no safe level of alcohol consumption. It is ranked the most severe disability on the FASD spectrum of disorders. And birth defects are low birth weight, a small head, learning disabilities, and small weight and height. Thank you, and here's my audience.
Good job.